All right, so then the last of the inert tissue that we have are the bursa. Okay, there's a lot of different bursa around the knee, and they're named primarily as to where they are, if they're deep or superficial. So then where would you expect to find the prepatellar bursa? Out in front of the patella. So it's between the patella and the skin. Then you have the infrapatellar bursa, which is below the patella, but you have a superficial and deep, and that has to do with relationship to where it is as far as the tendon. So the superficial would be between what? The tendon and the skin. And then the deep one would be back here. And then other ones are going to be named based on where other areas that they insert, where you have the pes inserine bursa, which is on this pes inserine area. Remember what attaches to the pes inserine? Sartorius, gracilis, semitendinosus. And that's the medial part of the knee here. Okay, and then you're going to have the iliotibial band bursa and suprapatella, which is up above the patella here, but it's actually underneath the tendon. So if somebody's banging the outside of their knee right here, which one are they going to injure? Right, prepatellar. A lot of times that's called housemaid's knee, or so you know, put pressure, repetitive pressure on the knee. You can have some superficial swelling, would be prepatellar bursitis. Okay, so now we'll start talking about the conditions. And then again, the same way that when we talked before, we'll start with the inert tissue conditions, and usually those are going to be the traumatic types of things. So you can have various different areas where you can break the knee. So you're either going to break the femur, the patella, the tibia. Okay, you can see on here, you can have breaks up here into the femur. You can also, what's called these tibial plateaus, you can have fractures into here. Now, anytime when you have a fracture and it goes into the joint surface, that's going to be critical, because that needs to heal properly because it has to do with the joint surface. So obviously, you can tell it's going to be more complicated if you're breaking up the surface of the joint, whereas if you just snap the bone in the middle of it, right? Then all you're dealing with there is just bone healing. Whereas if it's in the joint, when it crosses the joint, then you're disrupting the surface of the joint, and that can be a problem. So a lot of times those types of things, they have to go in and put pins and screws and things like that. Now the thing with the knee is that there's a lot of different videos and pictures and things where you can see knee injuries. And we'll look at some of those. Some of you are going to want to go like this. Right? Some of you will look. If you've had a knee injury before, it's going to be more, you're going to cringe a little bit. Okay? So I'll try to warn you. If you want to turn your head, you can. So medial collateral ligament, again, what kind of a blow is that going to be injured from? Coming from the medial side or from the lateral? Yeah, so they're forcing it out like this. Okay? Or you could get hit here distally at the ankle. So in the knee, we'll talk about, you can have a direct blow that might be one direction, and then indirect, you could be hit down here, it's going to do the same type of thing. So basically, the medial collateral tends to get more injured more commonly than lateral collateral. It's more common for somebody to get hit like this rather than getting hit on the inside, because for one thing, a lot of times your other leg's in the way.
Yeah,
you're doing it backwards. So it's,
okay, sorry.
Yeah.
Never mind. Yeah. You know what I mean, right? So yeah, this way. Right like that. Yeah. Fibula's on that side. Left side. Okay. So we're talking about medial collateral like this, and then like that. So it's the left side. So we do hit like this. And then again, we've talked before about when you have a sprain, you have different degrees of a sprain, right? You can have first degree, second degree, third degree. Third degree is where you're going to get up to about 90% or complete rupture of the ligament. And then again, because on the medial side, it's attached to the meniscus, so a lot of times you can get associated medial meniscus injuries, and then also the ACL and the medial meniscus and the MCL tend to go together. Like I said, that's usually called the triad of the knee, the medial collateral, anterior cruciate, and medial meniscus. And so then this is one of the special tests. Basically what you're doing is you're forcing it into valgus. So you'd be doing this type of thing to evaluate the medial collateral. But basically, clinically, someone's going to say, yeah, I got hit from the outside of my knee. It's going to be tender and swollen on the medial side like that. They're going to say that when you have a knee sprain, a lot of times the knee's going to give out. Okay, I had the type of thing where I was getting off a chairlift and I was wearing somebody else's skis and I didn't adjust the binding so they were too tight, and then my whole leg went out like that, and then I felt the knee do things that it wasn't supposed to do. And when you know about the anatomy and things like this, it kind of makes it worse because you know what you did. I said, you know, my femur is not supposed to move out of the joint socket, right? So I felt things popping around. I'm like, that's not good. And then also, at the same time, I had an ankle sprain too, but I didn't realize that until later because I was focused more on the knee. And so I had the whole thing with the gun. They put you in the sled and take you to the bottom of the hill. And then, you know, it's one thing when you see a knee test being done like this, but when it's like this and you're looking down and seeing them do things on your knee, and they go out like that, and you can see it doing things it's not supposed to do. So in this case, when you know about those injuries, you know what it's not supposed to do. So they're going to say that, you know, they felt something give or clunk or move in the knee, and then it's going to feel unstable or loose. And that's going to apply to any of those ones: anterior cruciate, posterior cruciate, medial collateral, lateral collateral, all those different things together. And then you're going to have swelling, edema, fusion. There's going to be palpation. Obviously, you're going to be able to palpate the collateral ligaments, but you can't really palpate inside into the cruciates, right? So you're going to have tenderness on the side here for the different collaterals. Neuro's not really going to show anything, and so then I'll show this test again. The camera's a little bit up high, but what I'm doing is pushing the distal part here. Make sure I get this right. So since it's the other leg, I'm going to flip it around like that. What you're doing is pushing this way. Right? You're taking the ankle and moving it laterally. So, so you're grabbing at the ankle and then stressing that medial side and just pushing out like that. Okay. So again, depending on if it's, you know, some big huge football player or something like that, it's one way you can do it like this, but you might need to get more pressure in like that to push straight laterally from the knee. Okay, so then lateral collateral again is going to be flow from the lateral side. Medial side. So you're pressing here at the knee, or it could be a distal blow to the distal part of the ankle. Anything that's going to stretch this lateral collateral ligament. So on the test here, then you're doing the opposite way. You're forcing from the medial side to the lateral side of the knee, stressing the lateral collateral ligament. In this case, you're doing it like this. They're stretching this side on the lateral with the fibulars.